Hi, I'm Dr. Bob Kiser. I'm a family physician by training. I attended Abilene Christian University for my undergraduate degree and then received my MD degree from the University of South Florida College of Medicine. I've also had the privilege of attending several other schools. I'm a lifelong learner. Most recently, I completed a Master of Science in Bioethics from Creighton University. Most of my adult life was spent in the Navy, where I retired as a Rear Admiral. In that setting, I had the privilege of leading many individuals and being a mentor and counselor and coach to those same individuals. While I was in the Navy, I had the privilege of being a commanding officer for the Naval Hospital in Guam. I loved the little island in the Pacific. I also was the chief medical officer for Navy medicine, and I was the head family physician in the Navy, where I had the responsibility and privilege of leading about 500 family physicians in various states of training. I also have served as a commander of Naval Medical Center in Portsmouth, a large multi-specialty teaching hospital. And in that setting, too, I had the privilege of, again, coaching and mentoring and leading individuals and preparing them for future success. Since I've retired from the Navy, I became a professor at the University of the Incarnate School of Osteopathic Medicine, where I have the privilege of teaching leadership and ethics and physician personhood and physical diagnosis and clinical reasoning and a bunch of other things to the young students there. That has been an extraordinary experience for me. I've learned a lot, I've grown a lot, and for the past several years I've served on the admissions committee at my university, my medical school, which complements service I did previously on the admissions committee at Texas A&M University. My joy in teaching is watching people develop. It's a privilege to get to walk with folks as they journey down the path that I've myself have journeyed, and it's an honor for me to get to walk with folks along those journeys. I had a host of military awards, of course, when I was in the Navy, various medals and things of that sort. But the award that I'm the proudest of, in all honesty, is that last year I was elected by my students for membership in the Gold Humanism Honor Society, which is a collection of individuals who've been identified by their peers and their protégés as somebody who embodies the humanistic principles of fairness and goodness and kindness. I also have received, humbly received several accolades from the students in other areas in terms of my ability to be present with them in the midst of some turmoil or some difficulty. And that is also something that I'm very proud of. You know, medical school is hard. Medical school is difficult. But what's interesting about medical school is that the hard part is not the individual concepts. The individual concepts themselves are very understandable. What's difficult is that there's 8 gazillion individual concepts. And so I think, from my perspective, the keys to success in medical school are twofold. First is perseverance, as one needs that stick-to-itiveness, if you will, to complete the course successfully. But I think another really important part is community. At my medical school, we say cooperate and graduate. We encourage folks to come together. We come together as faculty with the students, and in that setting, in that sense of community, there's protection and strength and resilience and support. I think the important part about being a good consultant, a good mentor or coach to somebody who's applying to medical school is twofold. One, having an eye for the specific qualifications of the individual, which sometimes transcends MCAT scores and GPAs, but also, I think, seeing myself in their position as a physician. And I think a good educator, a good mentor, a good collaborator, I guess, in this process of admission is somebody who can take their own experience, good and bad, and translate that into something so that they can help the individual they're trying to assist in navigating those same waters, but without all of the angst and turmoil or minimizing that. One of the things that I think I bring to this that may be a little unique is that I see success already in the individuals that I'm encountering. I see them at their very best. So one of my jobs, I think, is to be that positive model, helping somebody envision their success, and then having a role in getting them there. That is a great source of joy for me. I think my greatest strengths as a coach or a consultant have to do with a couple things. One, I have been in this role for a long time. I have walked with people for a long time. And I think in that process I've gained some perspective again that is valuable. The second is that I'm deeply and profoundly committed to the success of the folks that I'm blessed to lead or blessed to serve. Success for me is their success. And I say that not simply success in terms of getting into and through medical school, but success in terms of succeeding in life. I believe very strongly in that, and I believe very strongly in the potential of individuals to achieve those dreams. Sometimes somebody whose GPA may be a little low or MCAT may be a little low is somebody who will make an extraordinary physician. But I think seeing beyond that and investing in people who have qualities that transcend simply those numbers. Again, I think I'm able to do that and do that successfully. And quite frankly, that's where I get my greatest joy in this, is watching folks succeed. Whenever I look at the students at my university or the individuals that I have the privilege of interviewing for admissions to my university, I'm always reminded and struck by the fact that I have been where they are now. I have been in that seat. I've been across the table. I had very little help applying to medical school. The Health Professions Advisory Committee at my university was very good, but it was small, and they really didn't have lots of resources. My parents were blue-collar folks. I may not have gotten that help when I was a student, but I don't want prospective students to feel like they're alone or they're languishing. My passion, I think, in this is again recognizing that I have been where they are now. I want to provide for them the help that I would have liked to have had. I want to provide for them the perspectives I would have liked to have had, because now I have a chance to invest in somebody else. And I feel passionately about the profession of medicine. I feel passionately about its future, and I want to see good quality folks fill those roles and become a legacy for all of us who've gone before.